Rich Strickling lost his 22-year-old son Alex earlier this year to an opioid overdose.
He was full of joy. He didn't have a mean bone in his body.
Alex's death was ruled accidental. The cause, the powerful synthetic opioid fentanyl.
Nowadays, when kids start experimenting the way that all kids do, the consequences of that experimentation are deadly.
New CDC research shows fentanyl is now the most common drug involved in drug overdose deaths in the United States. Dr. Courtney McKnight with NYU College of Global Health says fentanyl is 50 to 100 times more potent than morphine.
People don't know it's being cut into the drugs, and so they're using maybe the same amount of heroin that they're used to using, but it contains a more potent opioid, and that's in many cases leading to overdose deaths.
The study looked at death certificates of people who overdosed from 2011 to 2016 and found a 54% increase in drug overdose deaths. Overall, more than 63,000 people died of drug overdose in 2016. Many of those overdoses often involve more than one drug.
We need to know that overdose deaths include drugs other than opioids, right? So we need to be thinking more broadly about this as a drug overdose crisis as opposed to just an opioid crisis.
After fentanyl, heroin, cocaine, and methamphetamine accounted for the highest numbers of overdose deaths by the end of the study. Ileana Diaz, CBS News, Los Angeles.